Good afternoon, everybody who's joined us. Thank you very much for joining NAHT's COVID-19 briefing for Leicester and the East Midlands. Please accept my apologies. If you joined us yesterday morning and we were having technical issues on our other platform, please do accept my apologies for the slight delay in starting again today. We currently have 3 of our panellists with us, which is great, ready to join you. While we're waiting for everybody to come into the room, if I could just bring your attention to the chat function. That's for you to introduce yourselves, say hello, while we're waiting for everybody to join us and get started. If you left any questions on the Crowdcast event yesterday, those are going to be copied into the questions on this platform. So later on, after we've heard from all our speakers, we'll be able to go through them. You have the option of voting for your favourite questions, and we'll go through the list with the most popular ones first of all. So my name's Natalie. I'm one of the regional organisers with NAHT. I'm facilitating this event. We've got with us Sue Welford, who's the Principal Education Officer from Leicester, Jo Atkinson, who's Public Health Consultant from Leicester. We've also got Chris Butler from Leicestershire, HR, and shortly we'll have Rob Kelsall, who's the National Secretary with NAHT as well. So hopefully we're going to have updates from everybody, and then, as I say, we'll move on to questions at the end of those segments. So the first person that I would like to introduce to you to update you on the situation is Sue Welford. Thank you.
Hi everybody. Nice to be online with all of you. Many of you have obviously I've have regular conversations with you, and some of you I talked to this morning about the situation here in Leicester. I think it's a challenge for many. We went in, like all local authorities, lots of work done all through lockdown, got ourselves all ready for June the 1st for the wider opening, and then gradually the numbers of children we saw were increasing in our schools and in our settings as more of our schools opened, and then more of our schools opened that more widely to wider year groups. What we did continue to see, though, were very low numbers with parents' concerns and worries about sending their children to school, which I know from colleagues across the region was the same in other areas as well. So what we've been working hard with schools. Schools are working hard to make sure that there was lots of information to parents to encourage them to start to send their children back. What we were seeing, though, was we felt we weren't seeing very many cases in school of COVID cases. We had a few schools who had one case, and amongst them a member of staff. And we did see a couple of schools who closed very quickly on that to help reassure parents. So despite the fact they didn't need to actually close, they chose to close for that reason. And so we knew that there were, everyone was doing their best to get ready, and also all preparing for the wider opening of all sorts of things from the 4th of July. And we kept on, like other LAs, and Jo will talk about this in a moment, is trying to understand what the data was telling us with very little data available to us. So all we had really was what communities were saying rather than anything hard and fast. Our schools were really working hard with their communities to encourage children to return and to support the children who were still at home. And as they got to the point of opening more widely to more children, we saw the Secretary of State stand up and say, there's a spike in Leicester, which is almost the first we really knew about that. And that had an immediate effect on our attendance in schools. So the following day, our attendance in our schools dropped by a third across all our schools. Over the following week, it started to increase again as schools reassured parents and the like. And then, of course, we got the view about the local lockdown. The local lockdown, we still did not expect to be impacting on schools. We thought we would be continuing to have schools open as they were, but probably not widening the opening more. Those you'll all know that, of course, we finish on Friday of this week as the end of term, so we were expecting just to continue with our already opening arrangements. So when the announcement came on the Monday evening, that last Thursday only key worker and vulnerable children should come into schools, that was a significant challenge. Schools responded very positively and well to that. There was a number of concerns about what was being said in the media around schools being the core route for the lockdown, when all the evidence was saying that's not what we were seeing. But our staff, our head teachers, all of you responded really well to that. And we are now at a point where we have quite a number of schools that are open, but actually have no children attending, because key worker and vulnerable parents, vulnerable children, have chosen to keep their children at home rather than send them in over this last week of term. Other schools are still seeing those children in and around and attending as they were. What it meant for our schools is putting back in place all the other arrangements for free school meals and the like, to make sure those children are getting fed and that remote learning packs are getting out. So at the moment, our schools are busy trying to consider what will happen for children over the summer, because like all schools, the decision was made that most schools will not offer over the summer. At this stage, we can only offer in our holiday provision for key worker and vulnerable children, but that guidance came really late. So sort of that was last Thursday, it was decided that we could open for those groups. So our holiday providers are busy trying to work out how they can provide that offer. Alongside that, our schools are trying to get their heads around all the new guidance for next term. And having to do that alongside not having staff on the premises, because with the local lockdown, unless you need to travel, you shouldn't be travelling. So it goes back to not having teachers or support staff on the premises if they're not needed to support children in school. So there's a significant pressure on our schools to try and get ready and think about what they need to do for the autumn term. And I've been having a number of conversations with head teachers about that over the last few days and weeks since the guidance came out. We've worked very well as a team, we feel, with our wider support in the council, developing template risk assessments, working very closely with our public health colleagues, and to ensure that we provide the advice and guidance as well as we can do. This morning I had a conversation about transport for the autumn term, which will be an interesting one going forward. But there are so many new challenges facing us all the time that we're all trying to problem solve and get our heads around. And it does feel like, with the schools working together, it feels like a big team effort to deliver what we need to for our children and young people. I'll just stop there. Any questions and things to Butler?
Thank you, Sue. I think what we'll do, actually, if it's all right with you, is if we can then hear from some of the other speakers, and we'll go on to some questions at the end. So thank you for that. And as you said, it's good to hear that schools working together. Rob's joined us now, Rob Kelsall. He's a National Secretary, NAHT. So I'm going to ask Rob to come in, if that's okay, and to speak next. Thank you.
So thank you, Natalie, and it's so good to see everyone this afternoon. And again, I'm sure apologies were made for yesterday's technical issues that we had. And I was watching the chat function, and it's great to see that the humour is still amongst the profession, because actually right now that sense of working together and that collaboration that you've just mentioned, Sue, is really, really important as we deal with the national emergency. Of course, we're in unprecedented times, and I wanted to start by thanking each and every one of you on behalf of NAHT for the work that you've done, for the tireless work and effort you've done during this national emergency. I think the profession can be extremely proud of what it's achieved during the pandemic, caring for those key workers' children, the most vulnerable children, and those children and families who were unable to send their children to school. I speak both as a parent and as a National Secretary of NAHT, the largest school leaders union. And I've personally seen the tremendous work and effort that each and every one of you have done for our children, and you should all be very proud of that. We wanted to bring people together across Leicester City and Leicestershire, and indeed the wider East Midlands today, just to essentially bring together that sense of professional community. Some of you may have been watching some of the national broadcasts we've been doing in terms of COVID-19. We've brought together over 15,000 education professionals to give that sense of guidance, support, and more importantly, to be that voice of reason amongst a very, very complicated and confusing situation for all of us to deal with. We've been working around the clock to produce timely and regular guidance to our members, to the profession. And we hope that guidance that you've been receiving from NAHT has helped to clear some of the fog and also some of the contradictory guidance that we've seen and sound bites we've seen from ministers and the Department for Education. I can assure you that each day that goes by, we've been airing those concerns of you, the profession, to the very top of government, and we challenge them when they've got it wrong. I'm sure many of you will have watched with the gas when the Prime Minister got to his feet on the 24th of May and pronounced to the nation that we was going to reopen schools and indeed open all schools to all children by the end of this academic year for those 4 full weeks. We said it then and we said it now that he was wrong to do that. He was wrong not to engage with the profession on how we was to move to the wider reopening of schools. And again, bearing in mind that we continue to send that message. Schools haven't actually been closed during the pandemic, and many schools have been working again to support those key workers' children and the most vulnerable. But whether it was about the partial reopening of schools, a full reopening of schools, whether it was summer opening, whether it's the national voucher scheme, the provision of laptops for children, we pointed out where they've got that wrong, and the government have had to, in many respects, do a number of U-turns. And now we hope that they're working with us to ensure that as we head towards the new academic year, that we start to work more collaboratively, like we are in other nations across the UK. We all want to see children and young people back in our schools, of course we do, but we want to do that when it's safe to do so. And there clearly isn't a one-size-fits-all to how we work towards a wider reopening of schools. And again, we've been airing those concerns to the government in the strongest possible terms. And what we've also maintained is actually when it comes to the reopening of schools, it's school leaders who ultimately make the decision, and that is something that, we stand by. So whether you decide to reopen the schools in, following the guidance in the way that you feel is safe, and we'll stand by you in making those decisions. Just a few days ago, we responded and produced some new guidance for school leaders in regards to the September opening, and indeed today a new web page has been launched that will again helpfully provide members with that sage advice from NAHT. In Leicester, we know that you've had to respond very quickly to the spike in COVID-19. And of course, what we've been saying, that there needs to be a plan B, and again, we welcome the fact that in the guidance issued last week, there's a recognition that as we move to wider reopening of schools, there may well be, and almost certainly will be, second spikes, second waves, in which schools then will have to readjust, and in some cases, like you are in Leicester, having to completely lock down. What we're saying is there isn't a one-size-fits-all. Schools will have those individual challenges. We have been again advocating a position with government that it's critical for school leaders in particular to look after yourselves. Many school leaders haven't had a break now since February half term. And of course, we know then when the pressure was building for schools to open over the summer, that if we was to stand any chance of catch up, as the government described, teachers, school leaders and children themselves need to be refreshed for that new challenge as we go forward to the next academic year. The announcement from government in terms of the £1 billion catch-up, of course, we've said the devil will always be in the detail, and we again have called out that the omission of 16 to 18, the omission of early years from that, but we're also seeing a knock-on effect to special schools funding too. And in fact, this evening and over the next couple of days, we'll be making our voices publicly known in terms of how that funding, in our view, doesn't match up to the rhetoric that we've heard from government. So as we adjust to that new normal, we are clear that you cannot just at the flick of a switch, bring back our schools in the way that we had before. And there is an opportunity, we think, to recalibrate the way that schools are held to account and the way that we run our assessment system. Of course, we welcome the fact that things like the baseline have been suspended, and we're in active conversations now with the Secretary of State and with Ofsted in regards to inspection and assessment going forward. So again, we'll be providing members with that advice and updates as those developments arise. So I just want to echo the point that's been made from Sue. It's really important, and that sense of collaboration now within the profession is more important than it's ever been. And we're again really pleased to be able to be joined by representatives from Leicester City, Leicester County, in regards to this discussion today. So I'm going to sit back and listen to the conversation, the questions, and again we'll certainly come back at the end to make a few points. So thank you, Natalie.
Thanks very much, Rob. Okay, so before I bring in Joe, what I'd like to just remind people of is the fact that if you're going to be taking part in social media around this event today, then we can use the hashtag COVID school response. And also, if you want to share with colleagues who perhaps were unable to join us at this revised time, we're going to make sure that everybody who registered for the original event has actually sent a link later on to the recording as well. So it'd be great if you could share that and look out for that later. Thank you very much. So I'd like to invite Jo Atkinson from Leicester Public Health. Thank you.
Hi. Right, I'll go through what we know in terms of the data and what's happening at the moment. I'm sure people will be more than aware that the number of cases of COVID has increased significantly in Leicester, particularly in June. We weren't aware of these until kind of mid-June really, because that's when we started to get the Pillar 2 test results through. I'm sure people have heard lots about that on the news. Before that, we only had the Pillar 1 test results, which is those that are carried out in hospitals and in care homes, whereas the Pillar 2 is the test that are carried out in the community. So by kind of mid-June, we knew that there was a potential issue in Leicester, and we started to get the data that we really needed kind of towards the end of June, sort of the last week of June really, which is like the postcode level data, so that we can actually map where the issues are. We're still getting a high number of positives reported on a daily basis, but it doesn't appear to be escalating currently, which is reassuring to some degree, but we need more data in order to be assured of that ongoing. Lots of measures have been put in place. People have seen some of the measures, some of them are very visible. There's lots of more testing happening in the community. So what we really want to do, we've got different ways of tackling this increased number of cases. One of them is increased communication and getting those key messages out and trying to make sure that everybody's following the social distancing guidelines. They need to isolate when they get a positive result, all of those kind of things. But the other thing is testing. So testing is absolutely crucial. So there's lots more testing sites that will have appeared, particularly in the east of Leicester, where we've got the high number of cases. So, and there's lots happening even door to door now. So I've got very local testing sites that are available, encouraging people to come in some areas of the city where they don't necessarily have symptoms. In the past, it's been people that are just symptomatic that have been invited for testing. But now we're opening it up in some areas of the city to people that don't have symptoms in order to get a real picture of the level of positivity. It's important, one of the things we monitor is the positivity rate, so it's important that we start to see the proportion of those people tested, proportion of those testing positive. We need to see that coming down, because that's part of what will be considered in terms of when do we start to unlock some of the restrictions that are in place. So that's being very closely monitored. Just to say, in terms of the age profile, we do have a younger profile of positive cases in the city. So people will have perhaps seen that the average age of the positives in Leicester is around 38 to 40 years old. So it's kind of working age adults, whereas in other areas of the comparable areas, it's kind of closer to 50. So it's very much focused, the positivity rate, very much around the working age population. There's been discussion, obviously, as was highlighted when Matt Hancock made his announcement, was around the high proportion of children and young people that have been affected and the number of positive results in children and young people. We are exploring with PHE the kind of statistical significance around this and how different it is from other areas. We do have a young population here. We have a large number of children. That may have been part of it. Obviously, it was disproportionately affecting children and young people and younger adults as well. So we're looking, what is important to say is it's still small numbers. When you look at the total number of positive cases, the number that are actually affecting children is quite small. So we're looking at around 300 cases in the 0 to 18-year-olds in the city. That's right from the beginning of the epidemic, so right from the end of March. So compared to the numbers that we've got that are affected across the city as a whole, that is a relatively small proportion that are children and young people, but it's obviously higher than some other areas. The majority though, so 3/4 of those are in June, so we definitely see an increase. That's different factors. Part of that is because we increased community testing in May, so we wouldn't have picked up all of any positives in the community before that because we weren't testing in the community. What else I would say is the positives. So the positives generally increased in June, and that was the same for children and young people. So there is that debate about whether school opening had any impact. We can't see, there doesn't appear to be a correlation between the year groups attending school and the number of positives in those year groups. So what we've seen is when we've looked at the age profile of positives, the highest number of positives are in our teenagers, our older teenagers, kind of 16 to 18-year-olds. Definitely the 18-year-olds by far have got the highest number of positives. So that needs more, we're exploring that further in terms of whether there is any association between going back to school, increased numbers of children going back in those year groups, and any effect on the positivity rate in those year groups. But on the surface of it, it's very much the older teenagers that appear to be affected. I mean, part of it is very difficult when you're testing children. Having taken my own child for a test, it's very difficult to test children. And I suppose it's easier to test the older teenagers, that they're more likely to be successfully tested. So there is an issue around that as well. But there is more testing going on in the community, not just of adults, but of children. So we'll start to get a better picture over the next week or so around that. I think that's probably the main points I've got at the moment, but happy to take part in it, answer any questions. At least try.
Thanks a lot, Jo. I think what we'll do, as I said, we will hear from everybody, and then we do have some questions which all of you, I'm sure, will be able to help out with answering there. Very interesting there to get a picture of get an idea of the picture there in Leicester, and lots to consider as well. So the next person I'd like to ask to speak is Chris Butler from County HR. Thank you very much, Chris.
Hi, afternoon all. Yeah, I thought it was useful for us to come on to this session because I think some of the questions that you as head teachers in the city will be asking are the same questions that we've been asked from head teachers in the county as well. And during all of this time, we've been working very closely with the Education Effectiveness team at County Hall. So they've been asked questions directly to head teachers, they've passed them to us, we've provided responses. A lot of the information is on the Leicestershire Leaders website, which I'm not sure whether you guys have access to, but I'm sure children and families wouldn't mind sharing that. But there's a couple of questions that keep a recurring theme that has been coming up, particularly probably not since the local lockdown where a lot of schools closed, and those that are actually the other side of the lockdown, the local lockdown, are only having, if the child comes from the city, then they're not travelling into school unless they're a key worker or a vulnerable child. So I've got personal experience of that. I've got a granddaughter upstairs who had just started back to school, but now she's back in lockdown and she goes to a Leicestershire school. So anyway, the questions that are coming up, I think I answered them on the questions and answers session yesterday. The main ones are about vulnerable people coming back into school after in September. And with that, I mean, obviously there is going to be, shielding is being paused as of the 1st of August. So the expectation will be that those people do come back into school. However, you're going to have both ends of the spectrum. You've probably got people staff that will be chomping at the bit to get back in, and others that will be really, really anxious about coming back in. And that includes pregnant staff as well. So the question yesterday was, will pregnant and other vulnerable teaching staff be able to return to work in the new academic year? And the response was, the short answer is yes. However, what we are advising our schools is to undertake individual risk assessment with those staff and consider any reasonable adjustments, such as redeployment to other roles, working in different areas, possibly working from home. And I know that's really difficult in a school, because you do need staff in the ratio of staff to pupils in schools to be able to open the school. But it is principally for us, it's about making sure you have those detailed conversations with your staff, individual staff, and address any concerns that they've got, and hopefully that will go a long way to alleviating some of their anxieties. But like I say, the main thing is to undertake the individual risk assessment and do all that you reasonably can to protect staff, so that you can demonstrate that you've fulfilled your duty of care. One of the suggestions that we've given is, where somebody is fearful about coming back onto the school premises, is probably trying to arrange a time when they could come in when there's no other staff around, just to have a look round, just to reassure them. And there's no reason why you can't suggest that. But ultimately, it could be a case where you've got somebody refusing to come back into work. You've done absolutely everything you can. And actually there could be an issue where they potentially could be in breach of contract because they're not available for work, and they don't have any good reason, apart from their anxiety, not to be available for work. And I know that's not meant to be flippant, because obviously those concerns are very real for a lot of people. So it is, you know, working with them. But ultimately, if they do refuse to come back into work, it could be that it's unpaid, or you might want to take a step further and deal with it as a potential conduct issue. But above all, before you do anything like that, my strong advice would be to speak to your HR providers, whoever you get your service from. So the other question that came up a lot was PPA as well, about staff covering and moving around in bubbles. As you'll probably know, the guidance now states that teachers and other staff will be allowed to move around to different classes. But social distancing must be maintained wherever possible. Again, easy to say but difficult to do. But if you have your cover supervisors or any teachers that purely just do PPA cover for management time as well, is to have, again, those early discussions with them and establish a plan of how that will work in your school. All schools are different, one size will not fit all, but it is, again, I would suggest about staff anxieties and reassuring them that you're doing absolutely everything that you possibly can. So I'm not sure whether there's any other questions that people might have that they wanted to share. But just to finish off, one of the questions that I've asked our legal team and have got a response for is with regard to the test and trace. At the weekend, I was looking at TES and I was reading some responses from some head teachers around the country to say that some of their staff have said to them that the staff have said they won't share details of other people with them. And I'm sure that'd be interesting for public health to hear that. So I thought, well, if we get those questions from any of our customers, I wanted to be ready with a response for that. So we did get a response from legal, which I'm more than happy to share with you. And actually, their response was pretty straightforward. The test and trace is an essential element of schools' risk assessment. Communication with staff is key and really important to get the message across that the expectation is that you will make it clear that you do want them to engage in that process. And in the guidance, some of the essential measures do include a requirement that people who are ill stay at home, robust hand and respiratory hygiene, enhanced cleaning arrangements, and just to highlight the fourth bullet point down, which is active engagement with NHS test and trace. So the expectation should be for school leaders, and make it clear to staff and unions, that all the elements that are referred to in terms of essential measures are required and should be supported by staff. If they absolutely refuse to do so, again, the recourse would probably be to, if they refuse to take part in any of it, is that would be a failure to follow a reasonable management instruction. And again, you could go down the route of conduct issues, safeguarding, or it may not even comply with your own staff code of conduct. There's also an argument to say that they wouldn't be complying with some of the standards for teachers. So, but again, I would suggest contact HR on individual cases, but that is just a broad brush response for you.
Thank you, Chris. It's interesting actually that you've picked up on the fact that some of the questions as well already you've addressed those, but we do have quite a few that have also come in. But just referring back to what you say about people considering the situations, their circumstances in their own schools, and NAHT have said that throughout. You know, the guidance is there, but to make sure that there is the flexibility for settings as well to do what works best for them and what's safest in their own settings. So that applies to much of this situation. So we've got some questions, as we've said, which were put forward. If you have any other questions, if you're listening, you've got anything which isn't on that list, please feel free to add to that list, to add your questions. We're going to put those to the panellists now. I'll invite whoever wants to respond to, rather than sort of direct them, so whoever wants to respond, whoever wants to jump in, just let me know. And I'm going to go the first one on the list. I'm afraid I don't have the name of the person who originally submitted these questions, because some of them were taken from yesterday. But one of these is, I know you've touched on it already, but we've talked about staff moving around. So just to reiterate, possibly, what will being in a bubble mean for PPA cover supervisors?
Oh, do you want me to answer that question? Sorry.
Sorry, thank you.
Yeah, I think, you know, because the expectation and the guidance, it does say that teachers and staff will be able to move around. Is that whereas before, when they've had the bubbles, you had to have the same staff in them, that is going to look different come 1st of September when schools do go back. But again, you know, my advice would be, and our advice to our customers has been, have a discussion with the staff and the teachers about how you expect it to work, and get everybody to engage in that, and actually get suggestions from the staff as well, because as you know, whenever you're discussing anything, if people feel part of the solution, then it makes for better working, you know, the process working better.
Thanks, Chris. I'm going to jump over the next one on the list, because it actually talks about pregnant and other vulnerable teaching staff being able to return to work in the academic year, with the new academic year, which you've obviously covered. You know, yeah. The circumstances, go to HR if need be. So the next question down says, with the need to maintain the PHE enhanced cleaning and regular and meticulous cleaning of resources, which will be in greater demand with all pupils returning, will schools still be able to consider building dedicated time into the week, for example, closing to pupils for an afternoon to facilitate this? I don't know who would like to maybe try and answer that one, if there is anyone who's...
If I just come in on that bit, one of the things that we need to consider is that the idea is that children are coming back full time, and we need to be trying to get that as much as we can. That should be the aim of what we're doing. And obviously full time is 10 sessions. So where possible, that should be, you know, there should be 10 sessions offered to the children. It is a challenge for schools, and certainly we've had conversations with schools about the additional having cleaning staff in during the school day to keep things running over, and that might mean you've got to change somebody's hours, a cleaner's hours or premises officer's hours to make sure that happens. So it is a real challenge to make that cleaning happen. Some of our schools are looking at isolating some of the materials, for the 72 hours so that they can then be used for somebody else, where that, if it can't be cleaned very easily. But, it's about exploring what those options are. And again, it's about, as Chris has just said, about talking to staff about what's possible, what's not possible. And it might be that some resources you aren't actually using. I mean, I know there's a question further on about soft play. And so soft toys, soft furnishings, and the challenge for that, moving that between groups of children would be very difficult, because you're trying to minimize the opportunity for spread of any infection. So it's all about looking at those issues and making sure you're taking whatever mitigating actions you need to, and making the decision that's right for you, your school and your staff, for your children.
But just comment further on that, if I might, Natalie, because I think, again, the parental engagement on this is going to be critical too, in regards to decisions around whether or not, I think in terms of making your risk assessment, that clearly, would be part and parcel of your risk assessment as to whether or not there are times that you'll need to, consider closing early for deep cleans or otherwise. But, parental engagement is going to be critical. But it couldn't help but also to say that part of those conversations we're having with the Department for Education right now, and indeed we'll be press releasing this later today, is again the double speak when it comes to the ability of schools to claim for the exceptional costs associated with COVID-19. We are extremely perturbed by political speak saying we'll do whatever it takes to deal with the pandemic. Of course, now we've got some further detail around the ability of schools to claim the exceptional cost. It seems there are, there's some smoke and mirrors going on. So we're asking the government to come clean. And by the way, 17,000 members have responded to a survey we conducted, which again will be releasing the results later today. On average, exceptional cost for schools just for the basic cleaning products is gone above £10,000 for schools. Some schools in secondary up to £30,000. Of course, that's not the only loss that schools have had. Obviously, there's significant loss being accumulated in schools through lettings, for example. And of course, when you start to add up the cost of that, on top of what essentially was, the middle of a funding crisis for our schools, well, of course, what we do know is that the Treasury needs to step up when it comes to ensuring, again, that our schools not only are able to deal going forward with the pandemic, and let's be frank, and you're facing this in the city of Leicester, and we'll see the second waves elsewhere, but this will be with us for a long time, and we've got to make sure that our schools are properly funded and supported, and there isn't this sort of smoke and mirrors going on when it comes to political announcements.
Thanks, Rob. Thank you for that addition. So I'm going to move on now to quite a different question, actually. It says, if we have a positive case in a bubble, and we know obviously the size of the bubbles are changing drastically from September, but if we have a positive case in a bubble, do other bubbles with siblings also need to test and isolate? I don't know if you want to step in, Joe. You've maybe got something.
Trying to find the right button. So this is if you've got a positive case in a bubble. So if the positive case, I mean, the siblings of that positive case would obviously have to self-isolate, but the entire bubble that the siblings were in don't need to self-isolate because they are contact of a contact.
Right. So
it would just be the siblings. So unless the one of those siblings then develop symptoms, in which case then you would be looking at whether other children within that bubble needed to self-isolate.
Thank you. So it's confined to within that bubble unless someone else becomes symptomatic.
Yeah, unless they develop symptoms, yeah. But obviously the siblings, definitely anybody in the same household as somebody that tests positive obviously has to self-isolate for 14 days.
Okay, thank you for that. And the next question says, that, would you recommend that before school and after school clubs do not take place as bubbles cannot be maintained? Anyone want to?
I think they're recommending that they can go ahead now, aren't they, from September? But obviously the less mixing the better, so it's trying to maintain bubbles within those after school clubs and breakfast clubs so that there's not, you're just trying to minimize the amount of mixing that's going on at the end of the day. It's very difficult to get that perfect once you've got everybody back at school, but it's all the way through school and after school clubs. It's trying to minimize the mixing between bubbles, and that's with staff and with children.
Yeah, added dimension to it.
So it's best endeavours on this, that, you know, if it's the right thing for your school to be running your before and after school clubs, supports the community, the families and those children, but it's, as Joe said, the how you manage that. And I've heard some very creative solutions this morning from head teachers who are looking at how setting up bubbles in a large room so that the children come into their normal bubble, but it's, you know, they can be supervised from a distance by single members of staff or a couple of members of staff, rather than them going back into their classroom areas or whatever. But some very useful techniques being thought about.
Thank you. And yeah, I think that's what it's, you know, it's requiring creativity, flexibility. It's that word again. So this comes back kind of to the crossover of bubbles again, but it's, you know, more specific in a different way. This question says, if we had 3 classes forward facing in the dining room for 25 minutes eating hot lunch, would we need to isolate all 3 classes if we had a positive case in one of these classes?
Not necessarily. It depends on, I think there would be an assessment undertaken. We'd get involved, we'd talk to PHE, and we'd look at how close those groups were together. Ideally, you'd keep them not all mixed together. So you'd have presumably three separate classes happen to be in the same large room, but as long as you'd want to separate them as much as possible, so that then you're trying to minimise the number of children that would then have to be self-isolating if you found a positive case. So it's the same thing, it's trying to maintain as much distance between those bubbles, even if that's within a big room, because if it's in a big room, then it may well be the case that you wouldn't have to isolate everybody. But it's trying to, again, yes, the best that you can achieve within the space that you've got. But there'd be an individual assessment undertaken of that, and we talked to PHE about what the level of risk was and how close the children were and whether they needed to self-isolate or not.
Yeah, so of course any guidance would always be to you would be consulting public health anyway, so, you know, take it from there. Thank you. The next question refers to PPA, and I know that you've actually addressed that already, Chris, so we won't actually go on to that, because it asks about whether members of staff who just provide PPA, will they be able to do this? They've got 5 different classes each week, and of course you've referred to the social distancing being part of the guidance, but that will be possible from September. But this is an interesting one here. It asks, how are SENCOs planning for the delivery of one-to-one interventions for pupils with SEND?
So this is a challenge for many schools. All of you have got children who've got some level of SEND. So the key thing is if you're doing an intervention, if you can do an intervention sitting side by side rather than face to face, that's what you should be looking to do. And again, looking at the contact that's happening. So if you've got your dedicated support for a pupil, then or for a group of pupils, then that person is working with those children who they need to normally work with. We also, in terms of this, also obviously both LAs and you know, there may be external people coming to work with that child as well, and it's how you make sure that anyone visiting to support that young person is able to socially distance from other staff members as much as possible. So the guidance is quite clear around some of this, but in other areas it is again that risk assessment and making the interpretation right to provide that support. I think one of the bigger challenges for many schools are young people with SEND who find the change is difficult, and how you support that young person back into school and provide the support in a way with people that they are used to or they can get used to. And so that careful planning by SENCOs for each child who needs that additional support will be essential. And, you know, again, risk assessments, looking at what needs to happen and how, you know, whether there is any protection needed. Obviously, if there's personal care going on for a young person, then the relevant PPE won't be needed. But for some schools, they're looking at perspex screens or and also visors. If that is, for a child who tends to spit, particularly, we've had that conversation with a number of schools where we've had children who spit when they're stressed. And really it's about trying to minimise the stress for those youngsters and taking that forward. Again, it's not one size fits all. It's about what's right for that child, for the staff, and for the school, in the school situation that's there, to enable that young person to be in school, receiving their education in as regular way as possible, that they're used to support their needs.
Thank you for that, Sue. I'm very conscious of the fact that unfortunately we had technical issues yet again, delayed the start of this broadcast slightly, and I know that the three guests that we have on with us today have got other meetings that they'll have to attend, so we have got time for maybe one or two more questions. I'm going to kind of combine the next two questions. They're both relating to bubble sizes. Just see if your thoughts on these. One question has said that if you've only got 97 pupils in your whole school, can you create a one school bubble? And the question that follows that says that we're a 3 form-entry juniors. Can we have year group bubbles? That's 83 in a year group. So any comments and thoughts on those two issues around bubble sizes?
So bubble size in terms of year groups, many schools will be ending up with year group bubbles. Some may end up with phased bubbles. But they're trying to, obviously that depends on the size of the school. To take a whole school into a bubble will mean that if there is a positive case and you've had free mixing, you are going to have to send the whole school home and do all remote learning. So that would be a real challenge in terms of really delivering what you're trying to deliver. But it needs to be the right thing for the school to manage the situation that they're working with. So it's about, the guidance allows you to choose the size of your bubbles, but it's about minimising the infection rate, but also delivering the education for the children with who you've got available. I'm sure Jo might have some comments.
Yeah, I mean, I would reiterate exactly what Sue said, actually. It's what's manageable, isn't it, within the school, but it's also, you're trying to minimise the size of those bubbles as much as possible, because as soon as you get a positive case, you're then looking at a lot of those children potentially having to self-isolate. So the bigger your bubble, the more children that are potentially affected. So it's to keep them as small as you can and still be practical to run the school. I think that's just the main point, really. So yeah, I'd reiterate exactly what Sue said. It has to be manageable, but we want to try and keep the bubbles as small as possible.
Okay, thank you both of you for responding to that. I think we will have to probably end that there. There were one or two more questions, but I think actually overall those topics have been addressed in what you've shared with us today. So thank you, Sue, Jo and Chris, for joining us for this briefing. And thank you to all of the audience, the people who attended the webinar as well. As I said at the start, what we will do is we make sure that we share a link to the recording so that you can look over this again or share with colleagues who perhaps may not have been able to join us for the rescheduled time. Again, well done for everything you're continuing to do. There have been links that have been shared during the chat, so if you're interested in perhaps becoming more involved with the union or you want to look at our advice and guidance, there's links in the chat. Also, just that's constantly being updated, so do refer to that. Don't delay phone the advice line if you can't find what you need in the advice at any point. I'm just going to see if Rob would like to maybe just have a quick last message before we leave you.
Yeah, thanks, Natalie. And again, just really echoing those points. It's so great to come together today. And thanks so much for the City of Leicester and Leicestershire representatives speaking alongside us in that collaboration to make sure that we support one another through these uncertain times and beyond are really, really important. So as Natalie has just said there, it's important that school leaders speak directly to their organisation. We're proud to represent 33,000 school leaders across the nation, and really getting involved in the NAHT for many of our people, has become some of the best CPD they've ever been involved with. So thanks once again for joining us. Again, we'll commit to ensuring that the voice of leaders is heard at the very top of government. Please, continue to feedback in the surveys and all of the sort of communications we're sending out to everyone. It really, really does matter. So again, once again, thanks so much for everything you're doing during this time. And hopefully we'll speak again very shortly.
Thank you.
Thank you.